You were live.
Good morning. I'd like to call the Personnel and Higher Education Committee to order. And first item is the approval of the minutes from last month's meeting. Moved by Supervisor Frazier, seconded by Supervisor Beatty. Any changes, corrections, comments? Hearing none, call the question. All in favor?
Aye.
Opposed? Carried. Next, we have privilege of the floor, public comment. Anyone have some words of wisdom for us? I don't see any, so. Okay, now we're on to the action agenda, and the first item is SUNY Adirondack. And I don't see anyone here from SUNY Adirondack. Okay, we'll go on to number two. Number two is a request to be discussed by the Human Resources Director. This is a review of the the report on tracking of vacancies filled. Are there any comments or questions about that? Two B is Mr. Schuett is here from Marshall and Sterling. And he's here to discuss our health insurance benefit renewal for 23-24.
Okay, thank you. Good morning, everybody.
Morning.
Thank you, Chairman, for usual pushing the agenda along. I only have 40 minutes or so. I'll try to condense it. We bet before. But yeah, so that time of year, and my name is Matt Schuett, I'm a Marshall and Sterling, and we've been handling the employee benefit programs for the county for a number of years. And the intent of today is really to just go through the renewal, of course, on a high level of where, the kind of the conclusions and seek to be able to move forward so that open enrollment can take place. First, I wanted to, because I know there's some, this is just good reminder, there's new people sometimes on the committees, is to discuss what we're doing in the background. But we formed a working group 2017, I believe it was, right? Is that right? And that was of that, the only self-insured health plan, there's a lot of private information that can be floating through there. There's a lot of specific information on claims that we get into, real cost containment items. And you can see, the members that we have, right on, I'm on page 2, of course, is there's 8 members of the group. And we are meeting typically quarterly. We just met on Monday and we had met in July in preparation, getting up to the renewal. And we're really digging in. We are going in and drilling down into claims experience, cost containment programs, any particular area that we can find savings to the county, which is also going to help the employees. Whatever we're talking about, we're generally trying to find a win-win for it, that everybody's doing better with it. The things that we've really focused on this year, and those of you who've been here for a little bit, we've really worked on cost containment programs. There are certain things in there that we're already doing to take advantage of manufacturers' coupons on the prescription side. Of course, any of you all know, I say it every year, if any of you want to chat individually on this, I'm always happy to do it and drill down into any level of it that you'd like. But again, the point of the working group meeting is to really do a lot of that grunt work. We spend a lot of time on it and we bring recommendations to this committee. What we've looked at in this year in 2023, we evaluated a different PBM, which is a prescription benefit management. You have Highmark today for medical and your pharmacy. We were looking at keeping Highmark on the medical side for their network and then utilizing potential different PBMs. And we spent hours on this, really deep dive, going through the analysis. And there was some savings opportunities to be had with doing it, but there was also some employee disruption potentially making some changes. So yeah, the thought for this year, the conclusion was just to hold the punt down the road on that decision. And in the meantime, we were able to negotiate better terms with Highmark, better rebate revenue, better discounts on the prescriptions. we continue to evaluate that on a yearly basis. I want to talk quickly on trends. We get to the middle section here. There's a variety of benchmarks. Kaiser Family Foundation puts on a benchmark. There's a number of them that do it. The consensus seems to be that healthcare going into 24 is going to be between 6.5% to 8% change across the board, across the nation. And I'm sure you'll all be stunned by this, but New York tends to be a little bit higher than the nation on some of this. Give you a quick example. The reason I'm telling you this, kind of a benchmark, and I know some of you obviously run your own towns and provide benefits for your employees via your town. The small, for 2024 in New York State, the small group community market, so this is employers under 100, so it's not applicable to Warren County, but it gives us kind of a benchmark of what's going on in the community. The average statewide filed increase is about just over 15%. Okay, that's filed, it's going to be approved at a lower number. The state has heavy influence on these rates for a small employer, but it's probably going to end up somewhere in the double digit rate, we would expect, is what the statewide average is going to look like. If you take that, I think this is always a good thing to look at. Look at Warren County's benefits. They are negotiated. Okay, we know we can't change them. And over the years, where the rest of the world continues to change and increase deductibles and copays, your plans right now, I would consider them like a platinum and gold type plans. That's language that the Affordable Care Act gave us a number of years ago, but you really have very, very high level plans compared to the market. If we were to look at what a small employer under 100 those plans would cost something comparable to your plans, they're between 25 to 40% more than what we've been able to negotiate set up at Warren County. You're in a very good place versus benchmarks. Continue to cost contain wherever we can possibly do it without member disruption. And again, your plans are great and much lower than benchmark, at least in the state versus small group. So I want to just pause there. Questions, comments at this point before I keep it going? Good. Okay. So as far as recommendations, again, for all the work that we've done and work through it, you have on your high mark plan, you have your active employees, and then you have pre-Medicare retirees are all covered through high mark. There's a 2.9% recommended increase to the premium equivalents, which, just as a reminder, last year there was no change to the budget. So it's 2.9, which is well below national and statewide averages, on top of where we were last year. So we're very proud to be able to, over a 2-year period, just cut that in half. You're 1.5% roughly change, which is much better than, again, what the rest of the world's had. On your Humana, your second bullet, your Medicare retiree coverage through Humana, that is down. The same coverage, no change in coverage, but had a 8% reduction in the rates. So Humana, anytime, we did go out to market, Humana has done a fabulous job. Some of you have been around when we first introduced those a number of years ago, and they have done a fabulous job. And over the years, we were talking, it was probably about $1 million savings on the table from Humana. That's held. So that's really been an amazing plan recommendation. Keep that plan. Retirees are very, very happy and very pleased with it. You have a couple other lines of coverage, your Delta Dental. The county pays a flat. Does it record it, is it? A flat amount per month to that. So there's no change to the rates, no impact to the employees, no impact to the county on that. Vision coverage is through Empire. That is a voluntary plan paid for by the employees. It has a composite increase. You have a high and a low plan there. Increase of 1.3%. When you're dealing with a single rate of $5, that is all practically, it comes down to pennies. that gives a single increase on the low plan of 4 cents and a 16 cents for the high plan. So those benefits are really, really solid. No impact to the county. You have other things. We rounded out your menu over the years of offerings, your voluntary coverages such as life, accident coverage, critical illness, no rate changes, no impact. Okay, so that's the high level. Any questions there? And you want me to go into a little further?
Just one quick, when we talked on Monday, this rate increase was 3.7%.
Yes,
Correct. Okay,
yes.
all right, so we're down to 2.9 because of the new data, or have you worked your magic?
Nope, there is 2 reasons. So it's a good point. We took, at the time, we were looking at that on Monday, kind of as the worst case scenario.
Okay.
And at that time, Highmark had an extra fee in there if we moved the prescriptions out to like a Maritane or a Proact. So once we agreed on Monday, we weren't going in that direction, we were able to move that, and we accounted for the increase in the specific with the stop loss also. And just to speak to that really quickly, the county intends over the years to run pretty close to 0. In other words, not wanting to add surplus necessarily and not want to dip into it too much. So where we're budgeting is really where we expect claims to be without padding or subtracting. We've been pretty spot on with the budgeting over the years. Thank you though, Mike. Any other questions?
Just a quick question on the Medicare Advantage page and down on vision, getting down to vision benefit, it says vision hardware. And it says $100 max every 12 months. Now, that $100 max, what, how is, could it be less than that? Could it be $50? What's the, if you're a provider, how do you determine $100?
Well, I will say, were you asking, can we make that less or are the costs less just in the margin?
Both, yeah.
Okay.
Yeah.
So yeah, these are things potentially, and we're on page 6 now, where yeah, these are some on the Medicare Advantage plans. These are some addings that they have in there, and certainly you could potentially remove that or reduce that, and it would save like a penny or 2. You know, it's such a very small factor. Any of you who have used wear glasses, you know how $100 can be used up pretty dang quick, right? So yeah, that probably, I doubt somebody using it, they're probably using the full amount.
Yeah. Okay, good. Thank you.
Okay, so we left off on page 2. Just go to 4 quickly. So these are your 2 plans. And if they look familiar, they haven't changed in an awfully long time. Okay. The plan on the left is where a great bulk of your enrollment is. And as I mentioned earlier, I was just using Affordable Care Act language. This plan in today's world is pretty much what you call a platinum. Really, really high benefits, high quality. No deductibles, just regular copays. I should point out, your employees can go to doctors in this area. They can also go to doctors anywhere across the country, or a doctor or hospital that accepts Blue. We have the largest network in the country. The plan on the right, we added early on in the process. It's voluntary. The employees can choose it if they want to save a couple bucks. And it's a high deductible health plan that is coupled with a reimbursement arrangement. Okay, you have the reimbursement arrangement in there. That plan, because of the HRA, is kind of like the gold plan. Again, very high quality. And if you want to turn the page with me, this shows you on the top, these are your premium equivalents, are the target rates for our budget. Is showing the rate should be. On the very top is what it is today. These are the today rates. And yes, I know if you haven't seen these or you've seen them once a year, it's sometimes stunning to look at what healthcare rates are. Okay. On the top is your EPO plan and your high deductible plan, what current rates are. On the bottom is the renewal at 2.9%. The county then takes these rates, on the bottom as an example at 805, and then that's split up based on your units. However, whatever bargaining unit you have, let's just say it's 80-20. That's kind of the average cross. That's how it's cut up. The question comes up, it came up in the meeting, well, are these rates competitive? Well, again, I'll just give you an example. If you look at the community rated market, a single rate now for a platinum type plan is over $1,000 a month. Hey, and a high deductible plan is in over $850 a month. So. Yes, it's getting crazy, but you're doing, costs are getting crazy, but you're doing much better than average. That's anywhere you can. Questions? Overwhelmed with happiness. 0% last year and 2.9. We couldn't get better than that. Well, the last page we talked about a little bit. I just want to point out the Humana plan, no changes. Very, very high level of service, very high level of satisfaction with it. Again, we have an 8% decrease. So we have a current rate on the left. I've gone to an initial rate and then a final negotiated rate that's under $200 a month. This is a savings, basically of 538 Medicare retirees on here. So there's $111,000, call it $112,000 of savings. The county won't realize all of that because you have some people that pay a share, but you also have a number of retirees that you pay 100% for. So there's a small increase to the county on the active side, decrease over here. When you wash these two together, overall the budget's even a little bit lower. No changes to that plan. We did look at alternatives, but it made sense to just sit tight there. How did I do?
Very good.
Yes.
Change in the HRA admin, just so we could the language in the resolution.
Yes. So right now, Marshall and Sterling well, let me back up. On your high deductible health plan, that's the one that's voluntary. There's an HRA associated with that plan. So essentially, the county is providing the employees back out of the $1,500 and providing half of that back to them if they need it. People who don't need it don't get any money back toward it. We're just covering the first $1,500 deductible. The first $750 is covered by the county. Employees pay less for that plan, and Marshall and Sterling's been administering it. It's more, we just determined we were paying the providers directly. And I'm sorry, we were paying the participants directly, and then they were paying the providers. We found a more efficient way to do it, where Highmark can administer it, and Highmark has a relationship with the provider. So they're integrated with the providers automatically. Employees are going to be able to use their card and swipe, and the claim will get paid automatically right to the provider via Highmark. Okay, so it's a change of administrator from Marshall and Sterling on that side to Highmark, which is who administers the rest of your medical benefits. And I guess just to say it too, we're asking for, and if I mess the language up, please let me know, but for authorization of the resolution to approve what we talked about on the bottom of page 2. 2.9, all the other options -8. That way, the point again of doing it now, approval here, approval in at the board supervisors meeting, and that way we can get going and have an open enrollment meeting so everybody can make their changes in time.
Very good.
Any questions for me?
I don't see any. Yes, Mr. Beatty.
Thank you. Thanks, Mr. Chairman. So are claims up or down for the county? I didn't see, did I miss that somewhere?
Well, they are, but not dramatically. So if you want the short version, if you want to look at page 5.
Okay,
And this gives me an opportunity, that's sometimes the question too, as well, why are costs going up? There's a myriad of things that's going into the increases. A big driver of it continues to be pharmaceuticals. massive increase in spend. Of, if I was to put it in two different buckets, medical claims and pharmacy claims, your pharmacy claims are going up high, faster than your medical claims. That's consistent with every employer across the board. The other thing is, well, it's particularly your specialty medications. Again, I say you, that's everybody. Specialty medications, it's not uncommon for employers to have prescriptions that cost $100,000 a year. That's not an uncommon prescription. Some of them out there, we have a client that's dealing with a $1 million prescription right now. This is an injectable drug. Wow. This is an injectable drug. So this is a massive issue, not going away anytime soon, which is why we have to cost contain everywhere we possibly can. So prescription is a big side of it. The medical world not immune to inflation. Right? Everything costs more every year. So if you want to condense this on page 5, the targets on top currently budgeting for 11,161,000. On the bottom, it's 11,486. So that's $325,000 a difference. And then that number is split. They basically 80/20. We pay a share, we pay a share of that. So the overall increase to the county out of $11.5 million is about 260. And but, which I didn't do the calculations, we can, but if on the next page, you're also saving on the human side. So maybe it nets out to be 175, 200.
So, because pharmaceuticals are costing more and more, the drugs are costing more and more, there's new drugs on the market, and they're very highly expensive. You know, and they're being approved, you know, and so forth, so. I'm sure you guys do trend lines and so forth, you know, and this going up only 2.9 is great. Humana went down 8%, and yet the overall cost still only went 2.9, which is in my mind very, very impressive. But where do you see it, you know, if this trend continues with these, for example, you made the example, one drug alone is $1 million to an individual in the plan alone. I mean, and I'm not asking you to predict the future, but on the other hand, next year is next year, and if these continued increases in the costs of these specialized drugs and so forth continue, are we in for a rude awakening next year?
It's been a problem every year,
Yeah,
to be honest, and it's not going away. Since we've been self-insured, the line that we've all said in the working group committee, and we've actually said it in this room, out of a 10-year period, you know, 2 of them are going to be doozies. Right. So far, with how we've been able to manage this, we've been pretty steady. But yes, we have to be prepared for that at some point in time, but we've really been able to tune your list down to the point where, you know, we don't expect wild swings. We don't know if they can happen out there. You may, I talked earlier about changing prescription benefit managers. You've heard of ProAct before, so you probably, that's a company that did have a relationship with the county at one point. We could utilize a company like that. Some of these companies are a little bit more nimble, and we can set up some things to take advantage of different programs out there to help eliminate the cost of that $1 million drug. Significant. So these are part of our working group meetings, you know, to determine is the juice worth the squeeze, basically, on some of these. And the thoughts coming out of it is, you all remember we went from Blue Shield to Highmark. That was a purchase acquisition. There was some disruption when that happened. I just went through, we were inclined not to have another set of disruption happen right after that one. But we're keeping an eye on, we are bringing to the groups every possible cost containment method to avoid those things.
Yes, Supervisor, you too.
What did you said the 2.9% increase is 325,000, 80% is 260. What did you say the net was after the Humana savings?
I ballparked it.
Estimate.
The only reason I ballparked it is because I don't have readily available to me the how many of your people, of your retirees are paying zero, down you're paying 15 or 20%. So ballpark, we could, plenty more than that. Guessing, yeah, we can, that's easy enough for us to pin down.
Treasurer Swan.
Yeah, just a comment, about your question, Supervisor Bailey, on the drugs. I can't remember how many years ago it was, but there are rebates that you can get on these things. And through their guidance, we have attacked that. So, what, I think it was $600 and some thousand, was it?
Rebate?
Rebate?
Yeah, anyhow, I think it was more like 8. This year, 800,000.
800,000 in rebates. So, I mean, we're actively, with the help of these guys, out there getting as much as we possibly can.
Oh, good.
Which to me, makes no sense that the drug companies have a rebate you can get. Why don't you just charge, you know?
Well, they're hoping some don't take advantage of
But
that.
that's the point. That's exactly it. Some of them don't take advantage of the rebate, so they're making a lot of money.
Any other questions?
Chairman, can I ask just one question, just on the liability side? What is the reserve? I'm not sure if you or the treasurer can answer it, but what's the reserve account look like? We're talking about $1 million, but you know, that unknown happening.
7.2 million is where we're at right now.
Thank you.
And again, just to speak to that, as a self-insured plan that's paying claims and has to account for swings, and potential upswing, you need a health reserve on that side. We are recommending anyhow, 6-7 months of expected claims. You're right about there. We wouldn't necessarily want to add much more to it. You got to be careful depleting it though. Right? So that's where we're really tuning the dial on. I think we have it in a good spot on this side and we recommend keeping it where it is.
Is it trending up, down, or is it staying constant?
We add a little bit every year so far. Not a lot, but
It's been pretty steady.
yeah,
Yeah, it's been pretty steady.
they're budgeting. I mean, they have guided us to a point where we're almost, I think, right on the money every year with our expenditures in this program. I mean, they cut it really close. So.
We're in a good place. So we need a resolution to approve this 2.9%.
Make that motion.
Produced by Supervisor Frazier, seconded by Supervisor Divitt. Any further questions or discussion?
Okay,
All in favor?
thank you all.
Aye.
Aye, opposed? Thank you, Matt.
Enjoy the Labor Day weekend.
You too.
Take care.
Here, Matt.
Okay, number 3, this is items to be discussed by the clerk of the board. It's a request for a transfer of funds in the amount of $5,573.42 from the contingent account to budget account 1010-440 legislative board legal transcript fees. Cover the cost of the bill from the attorney for the fees related to bonds secured by the county. Here to introduce that,
Make that.
Supervisor Frazier. Seconded by Supervisor McDevitt. Questions or discussion? Hearing none, I'll call the question. All in favor?
Aye.
Vote. Carried. Oh, yeah, no.
Yeah. So this morning, when we were looking over things in the agenda, we found that the resolution that authorized the contract with bond counsel expired. It was extended, but it was only extended through December 31st, 2022. So we need to amend 560 of 2022 to extend the agreement with Fitzgerald Morris Baker for the bond counsel services through, I would say, the end of this year, so that we can pay the bill. Otherwise, the auditor won't pay it.
Okay.
That's what we've done.
I'll make that motion.
Moved by Supervisor Beatty,
Second it.
seconded by Supervisor Frazier. Any other questions?
Yeah. How much were the bonds? What was,
I'm not sure.
That would be.
That'd be a treasurer. question.
I couldn't hear the question, I'm sorry.
How much were the bonds?
The original was 7.9 million, and we rolled over 5.8, I think, this time.
So was there a total of those two or?
No, the original bond was for 7.9 million. We made a large payment, almost 2 million.
Okay,
Okay, so the amount that had to be rolled over was just about 6 million.
okay.
And we have to pay, because we basically went out to market again to sell bonds for the next time. So, and our interest rate went up, and there's a fee for the attorneys to do the work.
Thank you.
Any other questions? Well, I'll call the question on extending the agreement. All in favor?
Aye.
Opposed? Number 4 is a referral from the Criminal Justice Public Safety Committee, chaired by Supervisor Geraci. And A is the Public Defender, and it's a request to amend the table of organization and salary schedule to reclassify the position of Assistant Public Defender part-time. The annual salary is $40,903. To Assistant Public Defender number 11 per diem, $60.76 per hour. The same annual salary of $40,903, and it would be effective September 18th.
Make the motion.
Okay, moved by Supervisor Fraser, seconded by Supervisor McDevitt. Questions? Okay, I'll call the question. All in favor? Aye. Opposed? B is from the sheriff, Mr. LaFar. And it's a request to amend the table of organization and salary schedule to create the new position of patrol officer number 74. Annual salary of $53,044, also effective from September 18th. Moved by Supervisor.
Sorry, I had a question. There's no impact to the county, is that correct?
Yeah,
Funded by the town?
right, it's for, I think the Warrensburg School District.
It's Warrensburg School Resource Officer paid by Warrensburg.
Right.
Okay, so I don't see the backup in it, but so my question is, the resource officers were basically being paid $30,000 a year, which was then reimbursable to Warren County. So I'm a little confused on this particular position. It looks like it's a new position for a patrol officer. So you're saying we're now paying, we're gonna add a new patrol officer to work at the Warrensburg School?
Thank you, Mr. Chairman. Yes, that's, they're all called patrol officers, the school resource officers. And they're paid according to the amount of time they work in the school. This will be a full-time position. It's reimbursed by.
So we've changed the verbiage from resource officer, which we used to call it. It was, yeah, no, I'm positive of that. We used to call a resource officer for schools to, now we're calling it a patrol officer position. We've changed the verbiage of the title of the position and we're changing again. It was my understanding that they were basically retired officers and that they were paid $30,000 by each school for that, of which we would initially front or whatever, and then we'd be reimbursed $30,000. And the last report I saw was a lot of schools hadn't even paid us. Is that correct, Mr. Treasurer?
We've caught up with everybody.
Have you caught up with everybody? Okay, because there's a lot of school districts that were, you know, that we were on the hook for some money, but they haven't paid up. Okay.
Can I just interject one thing? When we started the resource officer program, they were gonna do it with just retirees.
Right.
Okay.
Right.
We can no longer find enough retirees to do it. So now basically we have said to the schools, you're gonna have to pay the full price of hiring somebody to actually come and do the work. So this is why there's another position being created to go to Warrensburg School so that they can have a resource officer. I don't know about the verbiage. I'm not sure how that all works out, but that's basically it. And Warrensburg will pay us, reimburse us for the salary for that officer and the benefits.
So how long would this contract be enforced? For example, what if Warrensburg says after a year, we don't need a resource officer patrolman? Is that position still in the county? Or is that position eliminated if Warrensburg decides to back away from that?
That's up to us. So
That's a position we've created as patrol officer, yeah.
Could we put in the verbiage that if Warrensburg decides not to have a resource / patrol officer down the road, that position then becomes eliminated?
Yeah, I think so, but I'd like to turn to Tammy because I think she has more, because there are benefits that go with this as well, so.
So the title of patrol officer is the civil service title. There's no civil service title for school resource officer. That's why we have to use the title patrol officer. And we've done that with others. The other piece is this would be, I mean, it would be up to the board, again, what you did with the position, but this would be similar to what we do with our grants. We've added a lot of positions to our table of organization based on grants with the understanding that once that grant is no longer, that the positions would be no longer, but again, that would be a board decision at that time.
Yeah, and that's my point. Well, partially my point, that we should have verbiage in there that if that patrol officer is no longer, Warrensburg doesn't want them, that we should not be, that shouldn't be a permanent position in the sheriff's department. Because obviously, if Warrensburg says, hey, I'm done with the contract, or I don't want to do it anymore, that's all I'm saying. I don't want to, and you said it exactly, when there's grants, we always have stuff in there that says, when that grant runs out, we hire that person based on grant funding. When that grant funding runs out, that doesn't automatically become a permanent position. Otherwise, we saddle with a lot of additional positions. That's all I'm saying. All right.
And I would have to, if the board moves forward with that resolution, it'll be subject to a deeper legal review and some discussions with the county personnel officer on it as well.
Okay.
I can't give a,
Yeah, but it just makes financial sense to me that be in there just, and I'm not sure Warrensburg probably will never end it. But if they do, I just don't want to have additional positions.
I would just single it out to Warrensburg.
No, any school.
There's no position available.
Yeah, any school that decides that if we've added a patrolman specifically to handle any school, Warrensburg, Glens Falls, Queensbury, anybody. That once that, if they then determine after a certain amount of time that they no longer want that patrolman, then that position goes away.
And there's no position available anywhere else. For that person to go away. So
Yeah,
if no other school district picks up that particular patrol officer, then that would be it.
yeah, you see where I'm going.
all subject, of course, to civil service law.
Just one quick observation. In committee, I know the sheriff referred to this as a resource officer, okay? So that's how it was verbalized in
Right.
committee, okay?
Thanks.
So but I think to a certain extent, we have a good community in Warrensburg. We have a school board requesting a resource officer because they believe that it adds to the security, excellence of their school system, whatever. So,
Yeah, I'm not against any of that. I just want to make sure that the county doesn't be put in a position of having to add employees or what, that's all.
thank you.
That was moved by.
We didn't make a motion.
Okay, so would someone care to introduce that? Supervisor Frazier, seconded by Supervisor Etu. With the verbiage that we just talked about.
With the verbiage included that, okay. All right,
Any other discussion? Okay, I'll call the question. All in favor?
Aye.
Opposed? Carried. Okay, number 5 is a referral from the Environmental Concerns and Real Property Tax Services Committee, chaired by Supervisor Raymer. And Real Property Tax Services, and this is a request to amend the table of organization and salary schedule to create the new position of Geographic Information Systems Tax Map Technician, grade 17. Base annual salary is $56,356. Effective January 2nd, 2024. And delete the position of Senior Tax Map Technician, grade 16. Base annual salary of $65,900. Effective upon retirement of the current employee, planned for the second quarter of 2024. Introduced by Supervisor Beatty, seconded by Supervisor Etu. Any questions or discussion about this one? Okay, I'll call the question. All in favor?
Aye.
Opposed? Carried. Number 6 is a request and items to be discussed by the county attorney, Mr. Elman.
Thank you, Mr. Chairman. The one resolution request is the request for the county attorney's office to upgrade the service that we received through Lexis for software. I'm sorry, for legal research support. It's a necessary upgrade. The office has been using a rather basic level of Lexis service since I've been there. And this will allow us to more match our other attorneys that we are practicing with and against, especially in the civil litigation, which we are taking more of an active role in going forward. So, subject to any questions, that's the request.
so how much is this? Larry?
It works on the resolution request. It's a 3-year contract. It's a per month basis for all of the users in my office. It's $363 per month for the remainder of this year in 2024. And then the rates increase on the schedule for 25 and 26.
It's a little over 4,000.
Yep.
Each year.
That's correct. We've included the numbers for 2024 in our budget request. We're looking to move forward with it next month if it's approved by the board.
Someone care to move this forward? Yes, Supervisor Frazier. Seconded by Supervisor McDevitt. Further discussion? Call the question. All in favor?
Aye.
Opposed? Carried. Number 7.
If I could,
Yeah.
2 matters came up this week. I would ask if the board, if the committee would consider an executive session at the end of this regular meeting. I don't think it'll be too long.
Number 7 is items to be discussed by the county administrator.
Thank you, Mr. Chairman. Basically, this, we're recommending that we change the rules of the board. This past year, we've had a number of requests mid-cycle in between, and when I say mid-cycle, between the ending of one budget cycle and the beginning of the next, or out-of-cycle pay increases for a number of people. And this, we'd like to put in the rules of the board that all salary increases will be handled during the budget process, and there won't be any mid-year request for salary increases, because each one of those come out of the general fund. Now, it sometimes evens out in the end with vacant positions. However, in the interim, they come out of the general fund. So we think that we'll set salaries during the budget cycle, and any salary increases will occur during the next budget cycle. We also want to give the department heads the ability, and we talked about this before, included in this point is the department heads can hire when they get permission to advertise a position within a certain salary range. They can hire anywhere within that salary range. The only time they need to come back to the board is if they want to exceed the top level of that range. And that would take board approval. So we come back to the personnel committee for that.
So prepared to introduce
I'll make the motion.
Supervisor Frazier, seconded by Supervisor McDevitt. So one thing is the salary grade change only at budget time. And the second was,
That the department head can hire within that salary range. As long as we've agreed to the salary range when we advertise the position. And what I've seen so far when we do those, they never really exceed the existing salary of the person who's leaving. So they'll, apply a range to a certain position, and they can fill within that range.
questions, discussion?
So,
Yes, Mr.
so,
Beatty.
thank you. So. It's other information on item 7.
This is actually E8 I'm talking about.
Oh, okay.
E8.
Yeah, that's good. Okay.
If no other discussion, I'll call the question. All in favor?
Aye.
Opposed? Great. There's no pending items. The attorney has requested a brief executive session.
And if I could, it would be an executive session under Public Officers Law 105 subsection 1D to discuss pending and current litigation, specifically matters regarding tax foreclosure, as well as the pending lawsuit in federal court against the Continental Insurance Company.
I'll move that.
Moved by Mr. Beatty. Seconded by Mr. McDevitt. All in favor?
Aye.
Aye. Before we enter executive session, privilege of the floor, anyone like to comment or say anything? Okay, thank you.